Caring for your loved ones while far can be challenging. Are you a Kenyan, Nigerian, or Ghanaian supporting family back at home? Or do you live in a city and support family away from you? We know you care. We care too. Introducing DiaspoCare, an easy way to pay for healthcare services. Say no to the frustration, mistrust, inconvenience, and expensive way to transact. Pay now stress-free in easy steps. 1. Download the DiaspoCare app. 2. Register as a supporter. 3. Attach your card or load your wallet via mobile money. 4. Add a beneficiary. Pay for your beneficiary's medication from the comfort of your phone. Enjoy speed, high speed of transaction, affordability, low cost of transactions, accountability, wallet management, trust. Guarantee that the money is spent on actual medical services and no other thing.
All right. Hello, world. Welcome to Africa Let's Talk. My name is Collins Kofi Upon. You can always call me Mr. Beyond. Tonight, we will be talking about a company that is actually making it possible for you to support your family back home to access quality healthcare in the most convenient and easy way. My guest tonight is Mr. Jote Taddese. He is a co-founder of the DiaspoCare. So, ladies and gentlemen, if you have joined us, please help me welcome Mr. Jote Taddese. How are you, sir? And how are you doing today?
Good evening, Collins. Wonderful to be here. I'm doing very well, and I hope everyone, all of our audiences, are doing great as well.
I totally believe so. I know there is a lot going on with regards to health and the quality of health, even especially with the COVID and everything. But I hope that people are taking care of themselves, and even if they so happen to contract the COVID, they will still take care of themselves. It's quite crazy, actually. I know we are not going to be talking about COVID-19, but then it's quite crazy the number of people getting the COVID every day. Yes.
Absolutely. And I must say, actually, the global nature of COVID as a pandemic has also impacted those of our diasporans who are always worried about our loved ones back home, because COVID is all over the continent, and we still take the burden of taking care of our loved ones, regardless of what kind of illness they're going through.
Wow, that's interesting. And again, it actually sinks in well with what we are talking about today. Like I said, this company is actually making it possible for you to support your family back home to access quality healthcare in the most convenient way. And Mr. Jote, indeed, as co-founder of DiaspoCare, of course, we want to learn more. And for me, when I think and I look at DiaspoCare as a company, I think of it as a diaspora caring. Like those of us in the diaspora caring, is the diaspora actually not caring enough, especially judging from all the remittances and other economic interventions from the diaspora to Africa? Why DiaspoCare, and what actually is DiaspoCare?
Absolutely. Let me put it this way, Collins. Those of us who live away from our home countries in the diaspora, right? There's one thing that we all share globally. That is a social and moral obligation to support our family members that we left behind back home. And how do we do that? Most probably over 90% of us do that by sending money to our loved ones so that they can actually use that money to run their day-to-day businesses and lives. And one of the reasons we send also money back to our loved ones is to support their healthcare needs. So if anyone has sent money to their home countries from abroad, I can guarantee you that at least one incident, if not many more of them, is because of somebody in their family member who is ill, needing to cover their medical expenses.
Mm-hmm. That is very true.
So basically, DiaspoCare is all about making it very convenient, secure, and fast for me as a diasporan to pay for the medication needs or healthcare needs of my loved ones back home directly with the local healthcare service providers. So what that really means is I don't have to anymore send money to an individual and hope that they will use that money for the healthcare needs that they ask for,
Mm-hmm.
right? So what I can do is I can actually pay for the medication of that person directly to the local pharmacy so that my family members can walk in and walk out with the medications or healthcare needs that they have.
Wow, that is interesting. If you join the conversation, we're talking about DiaspoCare, and we're talking about how DiaspoCare is making it possible for you here, even in the diaspora, to be able to pay for medical expenses like drugs and medications back home so that your family can get the support they need. We're going to actually talk more into this, especially. So if you can just in a summary tell us the key problem that DiaspoCare actually seeks to deliver solutions as far as medication in Africa is concerned. What is, in the summary, the key problem that DiaspoCare is seeking to provide a solution?
Absolutely. One of the key problems that we are addressing as part of our DiaspoCare product offering is really virtually eliminating the problem of the diversion of healthcare remittances for other purposes. So through the researches that we've done,
mm-hmm.
up to a third of healthcare related remittances that are sent back home are diverted for other purposes.
Wow.
Now, we all want our loved ones to be better, feel better, and become productive members of society so that we all have a peace of mind about the healthcare status of our loved ones. And when we send the money for them to care for their healthcare, and it's not because they want to be malicious that they use that money for a different purpose, and in many occasions because life demands it. There are other priorities. And also in our culture, unless somebody is really, really sick, there isn't this culture of, going and getting a medical checkup, for example.
True.
Or saving for our healthcare needs, for example. We don't really have that culture. So as diasporans, what DiaspoCare as a platform allows us to do is simply, if there is a cost for medication that is about $20 or $15 or $10, we are able to make that micropayment directly to the local pharmacy so that our relatives can go and get their medications. Wow. Today, if somebody calls me saying they are sick, it doesn't matter what the cost of that medication or the healthcare procedure is. More than likely what I do is, even if the medication will cost, let's say, $5, well, I would feel very silly to send $5 through Western Union 10,000 miles away. Right?
Right.
And culturally also, it's kind of frowned upon, right? And so what we do is, to lose some face, right? We send 150, 200, 300, even more.
Yeah, more, yeah.
Yes. So sending $300 for illness that will cost $10 or less is not sustainable. If I have to send $300 for every relative that tells me that they are sick, I will go broke very quickly. So what DiaspoCare allows us to do is to make those micropayments, because there's no shame in paying for the $5 medication so that my aunt or uncle can go and get their medication from the pharmacy. Because that makes all the difference for them.
Right.
Right? And DiaspoCare allows you to do that. Be able to make that payment securely, efficiently, and also providing you with a visibility that what pharmacy is selling what type of medication to which one of your relatives for how much. Information that you and I have never had visibility to.
Wow, this indeed is exciting, because I can remember many a time where people back home you would have sent some money for medication of your parents, your sibling, or whoever, and then the worst happens, and you ask, "What happened to the money I sent?" And they tell you the truth. Okay, we needed to pay for light bill, we needed to buy foodstuffs, we needed to do this. So indeed, the diverting of all these monies now is well secured, because through DiaspoCare, it doesn't need to be fiscal money to their families back home, but then they can actually access medical health care or medication just by DiaspoCare. I think this is an interesting and indeed a very great solution to what we have all been contemplating on for a while. So please, if you are watching us and you have any similar experience about how difficult it has been to take care of your family back home in terms of their healthcare, and how DiaspoCare might be a solution to you, please share with us and let us understand more. If you have any questions for Mr. Taddese, please, you are also more than welcome to leave your questions in the comment box, and we will ask the questions at the right time. Mr. Jote Taddese, please, at this moment, can you actually share with us the journey of DiaspoCare from its inception to date? So when did it start, and how has the journey been like this far?
Absolutely. DiaspoCare started actually a few years ago, about almost 8 years ago. Wow. And we knew that the problem that we're trying to solve through DiaspoCare is not just only about enabling pharmacies to be able to sell their medications. And our view and vision and aspiration actually was a lot bigger than that. Since then, through this journey, we've incorporated some very exciting innovations into our platform. So the early on one I described, which is really the healthcare financing or microfinancing capability that allows people to pay for the small amount of medication cost very efficiently at a very small cost. Because the normal money remittance companies, as you and I know, the cost of sending $20 overseas is somewhere between $5 to $7, I believe.
True.
So that is pretty expensive. And how do we make it even cheaper, if not even eliminate that cost of transfer for payments of services such as medication purchases and other healthcare needs? That's one. Now, we have been listening to the customers who have been using our product. So we've been testing it over the last few years. And that is because the model is very complex. It's got many moving parts. We're connecting people that are thousands of miles away apart, right? And now we built a marketplace that brings the local pharmacies to be part of the platform, and also brings you and I, the diasporans, who have a need to care for our loved ones, onto the platform, and allows us to enroll family members that we want to support. But guess what? What if you have a sibling that lives in Atlanta or in Arizona or in somewhere in Europe, for example, and I do the same? I have two siblings. One lives in Atlanta, the other lives in Spain, Barcelona, for example, right? What if we want to collectively support our family members? So what we did is we built what we call the Family Health Wallet.
Family Health Wallet.
Yes, it's a Family Health Wallet. It's a digital wallet that allows me to invite my siblings. And now we chip into this wallet, which is intended to pay for the healthcare needs of our families. Now, instead of making payment for that medication from my own personal credit card, now the platform allows me to pay for the medications from the Family Health Wallet. Now we can start to save for our family's medication expenses on a yearly basis, right? So that now that actually took care of the needs for people who came to us and say, hey, I have a sister, I have a brother who lives in a different state, and I want to pool our funds together so that we can collectively support our families back home. That's how we responded. We built a Family Health Wallet. Now we took that to a different level. What if there is a community of people who suffer from a specific type of disease. Let's say chronic disease like hypertension, diabetes, right? And what if we want to aggregate those communities into a digital community wallet where we can actually start inviting supporters who want to be part of the supporting community for their loved ones back home, right? So we created what we call the community health wallet.
Wow.
That means if there is a community in Kumasi or Accra that is suffering from hypertension or diabetes, that community can be aggregated in a community health wallet where philanthropic organizations, church organizations can start now funding that community health wallet, where medications and healthcare services could be rendered from the local service providers that are already part of the network.
Wow.
It's a very exciting innovation that we built in. And now we are trying it actually in Kenya, in Ghana, as well as going into Nigeria.
Wow. That is amazing. And I'm happy of the journey that DiaspoCare is actually embarking on so far, just making sure that the healthcare of our family back home in Africa is well catered for. And we're going to be talking about these countries that DiaspoCare is currently operating. But before we actually do that, please, if you have any questions and you've joined us, you're more than welcome to actually leave your questions or comments in the comments box, and we'll take time to read out your questions or suggestions as we get into this conversation. All we are asking you is very simple, that are you or someone you know in the diaspora tired? That's all we're asking you. Are you tired of your healthcare remittances that is getting diverted into or for other purposes? DiaspoCare indeed has the solution, and that is what we are talking about as far as DiaspoCare is concerned. Of course, Martin Wiyama Brown says, can you share the website of DiaspoCare? Indeed, we are going to do that. And says, do you have a branch in Liberia? We're going to be talking about his questions. But before we actually do that, what I want to find out now is you mentioned currently that DiaspoCare is in Nigeria, it's in Kenya, and also it's in Ghana. Can you tell me why you chose these countries, and what is it looking like extending the services to other African countries?
Absolutely, that's a great question. So as you know, for any of these innovations to go into any specific market, right, we do an assessment of the readiness of the market itself, right? There are several factors that we look at. How conducive is the environment to bring in this kind of innovation? Are the right types of technologies, supporting technologies in place? For example, we facilitate a micropayment for medications and other healthcare services through the platform. That means we integrate with and work with payment gateway providers, fintechs, right? Financial technology providers. So, for example, we have integration with one of the most popular payment platforms in Kenya called M-Pesa. If you look in West Africa, we also facilitate the payment process through Paystack. That's another very popular financial payment technology providers as well. So these are the factors that we look at before we decide to enter into a specific market. There was a gentleman who was asking about if we are in Liberia.
Yes.
Coincidentally, we are actually testing as we speak the Liberian market as well. And I'm confident that pretty soon I will have a really great news about our vision and objective for Liberia as well.
All right, that's amazing. And again, Martin also asked about a website. So I'm going to actually put the website in the comment box, and then, or better still, the app where people can actually download. So I have the link. So please, you can check out the link in the comments box, and you'll be able to download the app and work with it in terms of you actually adding the families, the people that you want to support back home, to helping pay their healthcare back home, so that you can also do that. Now we want to know what have been the success stories from the countries that DiaspoCare operates in. We're talking of Kenya, Nigeria, Ghana. What has been the success stories so far?
Absolutely. So in a digital platform model, so one of the success criteria is how many of the customers have you been able to bring onto the platform, right? And as I said in the beginning, this is a two-sided platform that brings the providers of the service and the consumers of the service, right? So as of now, we have close to 500 pharmacies.
Wow.
And some of them are actually clinics with in-house pharmacies that are part of the platform. And we've also onboarded close to 600. And again, this is something that we are testing as we go from market to market. We have supporters from the diaspora that are Ghanaians, Nigerians, and Kenyans on the platform already. One interesting fact, Colin, is as we started testing this product and started telling people, especially the in-country folks in Ghana, in Nigeria, in Kenya, looked at it and say, wait a minute, I actually have the same need. I live in the big city in Accra, Nairobi, or Lagos, but I still have families in other parts of the country that I support.
That's interesting.
And why can't you allow not only the diasporans, but also the in-country supporters to make payments in local currency? So within the last 6 months, I'm happy to share with you that we've also enabled Ghanaians to be able to enroll as supporters and then enroll their beneficiaries and pay in Ghanaian cedis. And same for the Nigerians in Nigerian Naira. And same for the Kenyans. Now they're able to pay for medications using Kenyan shillings as well. So now DiaspoCare actually has become both for the diaspora and also for the in-country supporters as well.
That is interesting because actually even before we got onto the program, I was thinking about how people in the cities in most African countries would like to also support their families or folks in the hinterlands or in the small towns and villages. But it's exciting to know that they are also taking advantage of the platform DiaspoCare. Now we're actually going to delve into the functionalities of the DiaspoCare app. Can you explain the basic functionalities of the DiaspoCare app and how can people actually register to be part of the app?
Absolutely. So I'm going to start with what we call the healthcare financing app. So the healthcare financing app is very simple, intuitive app to use. It takes less than 30 seconds for somebody to download and register as a supporter. So you download the app, you go to iOS or Play Store, and you type DiaspoCare. You will find the app, download it, and the first thing you see is register as a supporter. And you register using just basic information. And right after that, you will actually verify your mobile number because we send you notifications about prescriptions, reminders, refills, and so forth. So it's important to verify the mobile number.
Right.
Once we do that, then what you do is you enroll your family members. Family members you can enroll is limitless. You can enroll as many as you want. In fact, if you have siblings, you can also create your family wallet and start to invite your siblings into that wallet. So basically, your siblings now can start to chip into that wallet, and you can start to actually support your families from that wallet. Now, that's the healthcare financing app. We've even gone above and beyond just the healthcare financing app. The pharmacies also came to us and say, it's great that you're allowing us to dispense medications and receive payments for them. We want to be able to run our pharmacy business efficiently. Can you provide us with a system that allows us to keep our inventory, track medication expiration, and have a point of sale system? And that's what exactly we delivered. Now we have what we call the pharmacy in a box, a very efficient system that is deployable on mobile devices that pharmacists can actually use to set their inventories and set their payment methods, how they want to get paid, and also have a point of sale system, right? And now the pharmacies are able to these are the mom and pop pharmacies who typically run their pharmacies on a manual model, but now we actually give them a system that is very intuitive and very affordable.
Wow. Wow. So now it's actually extending the advantages and the benefits to the pharmacies so that they can actually have their inventory. Also, so is all of these run on the DiaspoCare app, or this is actually done on a separate platform?
Absolutely. We actually have a very intuitive pharmacy onboarding manual that we train the pharmacies to be able to use this solution. And like I said, we have close to 500 pharmacies on the platform across Kenya, Ghana, and Nigeria currently. In fact, in Ghana, we have 100 of the most leading and reputable pharmacies in the country that are part of the platform already. So if anybody downloads our app today, we have what we call the pharmacy finder feature. You can actually tap on that feature and select which country you want and actually the cities and towns, and you will see right away which pharmacies that are part of our network that actually are in your family's neighborhoods.
Oh, okay.
So that you can tell your families the next time you go, make sure you go to pharmacy X to pick up your medication because they are part of DiaspoCare and I can pay for it from here.
Wow. So all they have to do is to walk to that pharmacy and pick up whatever prescriptions that they have.
All they have to do is they go to the pharmacy and say, this is my beneficiary ID, because when you enroll your family members, the platform gives you an automatic beneficiary ID.
Oh, okay.
So you give your beneficiary ID to your loved ones. All they need to do is to walk in with that beneficiary ID. They look them up. They create an invoice that in seconds will come to you as a notification, and you can pay for it manually if you want. That means from your credit card, or you can pay for it from your family wallet, health wallet, if you have one set up, right? Or you can actually pre-approve the payment if you want.
Wow.
So because of time zones, sometimes, by the time your loved ones go to the pharmacy, you may be asleep because of the 8 and 9 and 10 hour time differences. So the platform actually allows you to say, as long as the medications that, for example, my uncle picks up is $50 or less, I don't need to manually approve it.
Oh, okay. So it's to charge directly to the credit card on file.
Charge directly to the credit card. Yes, absolutely.
Okay. All right. Once again, this is Africa Let's Talk. We have left the link for the application in the comments box on Africa Let's Talk. So please, you can as well go click on that link, and then you can download the app and get it going. Like easy steps actually to really start using the app so that you can actually sign on your families and the people that you would like to support back home to receive the healthcare that they need, so that your funds that you send back home could not be diverted for other purposes, especially when you would like them to use it for healthcare purposes. At this moment, we'd like to talk about other incentives, because obviously now I know for me, the biggest incentives is the solution that you are bringing to the people. But then are there any other incentives that customers can take advantage of when they sign up with the platform? So please, if you can share with us if there's any other incentives that customers can take advantage of.
Absolutely. Now, one of the biggest incentives that we're currently pulling together is through our community health wallet, as well as the family health wallet. When we have a pool of people in a digital health wallet, that gives us the levers to go back and negotiate with the pharmaceutical producers about, hey, we have X number of people who are actually repeat customers of these kinds of products. And instead of selling your product for 5x in the past, if you sell it for 1x, right, you will pass the savings to the customers that are on the platform. That's so, for example, we have, as we speak right now in Kenya, we are running discounted medication purchases at select pharmacies that are on our platform.
Wow.
Right. And so that's one of the advantages of being part of our platform. Secondly, if there is a medication that your loved ones are taking that are hard to find, all you have to do is contact us, and we will find that medication at a reputable pharmacy at any corner within the country, and we will make sure that you get access to it.
That actually is very important because several times we've had that complaints come in from back home where they need a particular medication for a particular ailment or illness and they can't find it. So you are assuring us that all they have to do is to contact DiaspoCare, and wherever that medication is going to find it and deliver it to whoever needs it.
Absolutely. Absolutely. We have pharmacies on the platform that actually provide free delivery to any parts of the country, as long as the purchase amount is at a certain level. Now, we're actually negotiating as we speak to even make any medications to be able to deliver to the homes of our loved ones. Now, here's why. Because within our platform, one other innovation that we built in is we've also incorporated the concept of a caregiver. Now, what does that mean? So what that really means is in our culture, actually, and this spans across many parts of Africa, in any given family, there's always somebody who is a designated caretaker or caregiver of the family, the elder ones in the family, right? So what we did is we took that concept and we digitized it. So now when you enroll your elder uncle or auntie into the platform, you can also enroll the caregiver of the family into the platform. Now, when the medication prescriptions are generated, it goes to the caregiver. So your grandmother or your great uncle does not need to worry about, did I get a notification? When is my medication is going to be refilled? They don't have to worry about that anymore because all the notifications will be channeled to the caregiver.
The caregiver, wow.
Who goes to the pharmacy and picks up the medication and makes sure that auntie and uncle are taking their medications and digitally keep you updated as well. So that means as a diasporan, you will always know what the healthcare status of your loved ones is.
Wow. This is incredible. And I'm happy that DiaspoCare is actually taking it upon itself to deliver these solutions because really these are critical problems that are being faced back home in Africa, especially in homes that there are not the adults leave the home and then they only depend on caregivers. I'm happy to know that indeed the caregivers can actually take the part of assisting these elderly people to access the healthcare, the medications that they need on their behalf. So please, you have heard it of yourself. DiaspoCare is actually delivering solutions, not just when you need to actually send money back home about medication, now making it easy for you to rather do that through the app so that there's no exchange of physical cash with any family member, just so they can get the medication they need at the right time. I've been speaking with Mr. Jote Taddese. We are going to take a quick break. When we come back, we're going to actually wrap up the conversation. And if you have any questions, please leave them in the comment box and we will be right back. Please stay with us.
The past year has been challenging for every one of us. Are you or someone you know struggling to keep up with rent? If so, Rent Help is here to assist you. Rent Help MN is an emergency rental assistance program that serves the entire state of Minnesota. Renters can apply for past due rent, past due utilities, and upcoming rent. Applicants must be behind on rent for at least 1 month and meet the eligibility requirements. The application can be found on the Rent Help MN website at www.renthelpmn.org or call 211. Renters who have completed the applications may be protected from eviction. Don't wait until you are evicted. Apply today on the www.renthelpmn.org. If you need additional assistance to apply or to learn about the eligibility requirements, including household income, please reach out to the African Career Education and Resource Inc. ASAR at 763-307-4731. You can also stop by ASAR's office Mondays through Fridays from 9 a.m. to 4 p.m. The address is 6800 78th Avenue North, Suite 101, Brooklyn Park, Minnesota 55445.
All right, welcome back to Africa Let's Talk. My name is Collins Kofiopon. I've been speaking with Mr. Jote Taddese. We have been talking about DiaspoCare and the solutions that it's delivering actually in the healthcare medication back home in Africa. And we've talked about how they have introduced DiaspoCare in some African countries. We want to find out from Mr. Jote Taddese right now, what is the future of DiaspoCare and what is the plan to actually introduce the project to other African countries? I know you already mentioned Liberia. You're actually testing the project in Liberia. What is the future for DiaspoCare and the plan to introduce it to other African countries?
Absolutely. You know, we're a small startup, but we have big aspirations and visions, and our view is continental. We see a day when DiaspoCare become a household platform for the African continent. Right now, in the short term, we're looking at the East African bloc. We're looking at countries like Uganda, Rwanda, Tanzania as well. And of course, in West Africa, we are looking at Liberia. And we've been looking into the market of Cameroon as well. And so in the coming year, 2022, we have very exciting set of innovations that we're going to be bringing into this platform. One of the third things that I didn't mention about DiaspoCare is, in addition to helping pharmacies run their businesses efficiently through the pharmacy in a box solution, we've also implemented a pilot in Kenya for clinics, what we call the clinic in a box solution. So the clinics actually allow now the beneficiaries that are being supported by you and I can walk into a clinic and get connected with a doctor, get their diagnosis for any conditions they have, prescriptions being sent by the doctor to the pharmacy that is already participating in the platform, right? Now we're connecting the doctor with the patient, with the prescription, and of course with the pharmacy. Wow. So that is another exciting innovation that we hope to expand in these three countries. Also, we have some strategic partnerships that we're forming. We are building what we call the insurance marketplace. We are working with one of the largest healthcare insurance providers in East Africa, called Jubilee Insurance. We have some very important partnerships that we have already formulated in Ghana with healthcare centers as well. Because what we want to do is we want to provide access to telemedicine services through the DiaspoCare platform by innovatively and creatively partnering with telemedicine providers as well.
Wow.
So many exciting innovations that are in the line that we hope to introduce to the market.
Indeed, the future is exciting. And I would like to invite everyone, especially those of us in the diaspora, to actually download the app. Like I said, you can find it in the comment box. Download the app, get involved with DiaspoCare and all the exciting interventions and initiatives and projects that they are introducing on the app. Thank you so very much, Mr. Jote Taddese. Before I let you go, please, what will be your closing remarks? And if anybody wants to find out more about DiaspoCare, how would they be able to do that?
Absolutely. We encourage everyone, please visit www.diaspocare.com. And any direct inquiries, please send us an email to hello@diaspocare.com. We will get back to you right away. And either you are a healthcare professional, a person who's running a pharmacy business or a clinic business back in your home country, even you are an individual investor and you're excited about that DiaspoCare product and you want to get involved and you want to become an investor, get a hold of us. And we are open and willing and ready to work with you.
You are open and willing to work with. So I'm going to actually show the website. So please, if you go on the website, this is what you see, DiaspoCare.com, and then you will go through the website. So actually, if you can help us navigate the website, because I believe that people can actually download the app from the website. Is
Absolutely. Up on top, right corner, you will see the icons for Apple Store and Google Play. That's where you can go to download the apps. And also in the menu items, if you want to learn about us, you can click on the About, and that will give you a view of the folks who are involved. What is our story? What is our mission? What does the leadership team look like? And then our Solutions tab also gives you a quick overview of our three product categories. So So the healthcare financing app, the clinic management system, and the pharmacy management system. So this is really exciting, and this is made for the diaspora by diasporans, and now starting to serve the Africans within the continent as well. So it is yours, and we would like you to be part of this, because we want to bring this to your home countries, whether you come from Zambia or South Africa or Tanzania, you name it. We want to work with you to bring this solution to your country so that it can benefit your communities.
Wow, indeed. It's ours, built by the diasporans, indeed, for the diaspora. Thank you so very much, Mr. Jote Taddese. I cannot thank you enough for availing yourself to actually be on the program to talk about DiaspoCare. And please, listeners and viewers everywhere in the world, if you have any questions, you can always follow back, or you can actually go on the website once again, DiaspoCare.com, and you can find out all the information that you need to find out so that you can be able to register, or better still, download the application. Thank you once again for being on the program.
Absolutely. Thank you, Collins. Thank you for having me.
You are very welcome. All right, I've been speaking with Mr. Jote Taddese, the co-founder of DiaspoCare, and we've been talking about DiaspoCare, the platform, how it offers solution in the healthcare, especially for us supporting the healthcare of families back home in Africa, especially here from the diaspora. Thank you so very much, everybody, for joining. Like I said, you can always go on the website www.DiaspoCare.com so that you can learn more about the platform and the solution that it's seeking to offer in the healthcare, especially for our people back home and families back home. My name is Collins Kofi. Thank you so very much, and you have a great evening.
Caring for your loved ones while far can be challenging. Are you a Kenyan, Nigerian, or Ghanaian supporting family back at home? Or do you live in a city and support family away from you? We know you care. We care too. Introducing DiaspoCare, an easy way to pay for healthcare services. Say no to the frustration, mistrust, inconvenience, and expensive way to transact. Pay now stress-free in easy steps. 1. Download the DiaspoCare app. 2. Register as a supporter. 3. Attach your card or load your wallet via mobile money. 4. Add a beneficiary. Pay for your beneficiary's medication from the comfort of your phone. Enjoy speed, high speed of transaction, affordability, low cost of transactions, accountability, wallet management, trust. Guarantee that the money is spent on actual medical services and no other thing.